PT is an acronym for prothrombin time, and in the medical laboratories, the test is done to determine the activity of extrinsic pathway of coagulation. Whereas APTT means activated partial thromboblastin time is a type of test which may be done to evaluate the activity or performance of intrinsic factors of coagulation. Extrinsic if external and intrinsic when internal. Pathways means whenever body face trauma or injury, clot formation takes place as a healing mechanism after following a series of reactions. Here you can see the difference between the both pathways. The tests PT and APTT are usually a measurement of time period in seconds for a clot to be formed in plasma sample of a patient after the addition of reagents specific for PT and APTT. Normal values of PT and APTT are given here. Prolonged PT values may be an indication of liver disease, vitamin K deficiency, and the absence or deficient functioning of extrinsic factors. And if we have abnormal APTT values, it means that patient is having some bleeding disorder due to which clotting occurs slowly rather than normal, or there is deficiency of intrinsic factors of coagulation. Let's have its procedure at the last. First of all, we have to collect the sodium citrated blue top tube. The reason of selecting blue top tube for PT and APTT is that sodium citrate present in blue top inhibits the calcium, which is responsible for clot formation, so that addition of reagents may result in forming the clot and we could note the time period later. For prothrombin time, we put 100 ml of plasma extracted from whole blood after centrifugation into test tube. Then we add 100 ml of thromboblastin and 100 ml of calcium chloride. Start the stopwatch and note the time at which clot gets formed. And for APTT, we take 100 ml of plasma into a labeled test tube and add 100 ml of partial thromboblastin reagent and incubate. After that, we put 100 ml of pre-warmed calcium chloride and start the stopwatch to note the time period of clot formation. Then there is another term INR also used in the laboratories for coagulation profile. INR stands for International Normalized Ratio. Doctors usually ask to have the results of PT and APTT in INR form, which is normal from 0.9 to 1.1%. It follows the given formula. INR is equal to PT of patient divided by normal PT value multiply ISI, which means that International Sensitivity Index, and it's normal from 1.3 to 1.5.